Hello, I'm Dr. Lorenzato. This video is about hemorrhoids, a discussion up to the point of referral to a gastroenterologist or surgeon should that be needed. Hemorrhoids are engorged veins from either the upper 2/3 of the anal canal, the internal hemorrhoids, or the bottom 1/3, the external hemorrhoids. This demarcation, called the pectinate line, is important because the blood supply, the venous drainage, the lymphatic drainage, and the nerve supply to the upper 2/3 of the anal canal is distinct from the lower 1/3. External hemorrhoids, the lower 1/3, are painful. Internal hemorrhoids are not. Both can prolapse or push outside the anal canal. And frequently they both become inflamed, causing some leakage of blood from the inflamed surface of these veins, and bright red blood is seen on the stool or the toilet paper bringing a patient to the clinic. Lifestyle modification is the major thing a person can do when they discover they have hemorrhoids. There's the acute treatment of the problem, plus the changes to facilitate healing and for ongoing avoidance. Mostly this is an issue of diet with insufficient fiber in the diet. Fiber are the complex carbohydrates that when we eat are absorbed in the colon. There they are turned into essential short-chain fatty acids and other molecules. This is in contrast to starch and sugar, which floods our liver and produces packages of fuel that are deficient in fat-soluble antioxidants, creating more inflammatory problems. Insufficient physical conditioning is common, as well as prolonged period of sitting, which is different. As a person sits for a prolonged time, they're not allowing substantial circulation of the blood in the anal canal. White cells cannot get in and remove inflammatory factors, including bacteria or dermatophytes, yeast or fungus. Therefore, infections in the anal canal and to the outside skin, frequently from yeast or dermatophytes in patients that are pre-diabetic or prone to these types of infections, is common. Obesity can be highly contributory, most likely due to the increased pressure and the decreased circulation, as well as the poor antioxidant balance in many individuals that eat too much carbohydrates, eat too much starch and sugar, contributing to their obesity. Increased pressure of the venous drainage. As the veins drain the anus, the blood is moved back to the chambers of the heart, through the liver, and through the pelvis. Any increased pressure or mass in the pelvis, cirrhosis of the liver, pregnancy, any of these things can cause increased pressure in the veins themselves in the anal canal, causing hemorrhoids. Internal hemorrhoids, as I said, are painless. Depending upon the extent to which they protrude, they can be graded from 1 to 4. If they remain in the anal canal, they can still bleed and cause some obstruction in a bowel movement. If they extend beyond the anal canal but can spontaneously retract after straining for a bowel movement, they're termed grade 2. If they need to be manually reduced, grade 3, and if they cannot be reduced, grade 4. Generally, bathing or sitting in a bathtub will help if they're not easily reduced manually, and sometimes after a soak in a bathtub they can be reduced. Common symptoms of external hemorrhoids include pain on a bowel movement, sustained pain in the region after the bowel movement, particularly in thrombosed or clotted hemorrhoids, which can be very painful. A secondary infection can create a painful situation. Also, a sign will be bright red blood in the stool or toilet paper. Additional tests may be needed to determine if this is just external or also internal hemorrhoids. And itchiness is often seen as a result of a combined yeast or fungal infection, but also may be present if there are pinworms or other type of inflammation. Besides diabetes and prediabetes, antibiotics can produce a state where yeast infections or dermatophyte infections are more common, causing an inflammation and breakdown of the skin around the external hemorrhoids or internal external hemorrhoids, leading to problems. Other gut disruption from microbes can also do, as inflammatory bowel disease can be predisposing to this. Allergens and sometimes spicy foods for some individuals will create inflammation in the gut and contribute as well. Aside from the preventive management that we've mentioned, A person can get stool softeners over the counter. You can use moist cleaning to the area of the hemorrhoids after every bowel movement. Over-the-counter steroid cream to prevent any more inflammation, and antifungal cream, if you want, over the counter. And soaks in the bath, particularly, as I said, if the hemorrhoid is thrombosed, is almost essential. If not resolving, we may have further evaluation either by myself or a consultant. Other therapies that the gastroenterologist or surgeon might do include rubber banding and hemorrhoidectomy, which can be very beneficial and effective. Herbal suppositories are frequently used, as well as creams. They may be good, but they also can be complicating because of allergies or allergens that they present, as well as their much opportunistic marketing, and some of them are just a waste of money. Consider antifungal medication if this does not resolve very rapidly. Antifungal medications frequently combined with steroids. Treating underlying problems is essential. Over-the-counter medications include the stool softener Ducosate sodium, which is at 100 milligrams 2 or 3 times a day. Naproxen, which is an anti-inflammatory ibuprofen. I prefer naproxen at 2 pills of 220 milligrams each with food every 12 hours for the inflammation and pain. Herbal suppositories and creams can be used, and consider antifungal clotrimazole or beclomethasone together as a cream or lotion. Steroid suppositories, including hydrocortisone 25 milligrams suppository, is prescription and can be used twice a day for 7 to 14 days if needed. In conclusion, changing lifestyle, incorporating a better food plan, and sitting less time at any one time, getting up walking every 45 minutes, even if it's just for 30 seconds, very important. Hemorrhoids should be considered a symptom more than just a problem itself. We should look for any underlying cause of pressure upstream of the hemorrhoid veins if there's not an apparent reason for the hemorrhoids. Very good. I might order additional tests, make sure you're not pre-diabetic, make sure that there's not an inflammatory or an opportunistic infection going on, and I may refer you to a gastroenterologist or surgeon. Thank you.